Hey everyone, I'm Dr. Yomi Adeyemi. Today we're going to be talking about a major topic that a lot of people get wrong: how to treat knee pain without relying on surgery. Knee pain is one of the most common complaints that I see both in the urgent care setting and other primary care settings. If you're out there and you have knee pain, believe me, I'm with you. I had a knee injury as a high school football player, and ever since that time, I've dealt with chronic knee pain, so I get it. You might think surgery is the only option when things get tough, but what if I told you that there are scientifically backed methods that could save you from going under the knife? Stick around for the full breakdown, and don't miss out on the treatment options that might be perfect for you. Remember guys, watching the whole video will help this channel to grow. The whole reason I'm here on YouTube is to help share all the information I've been able to learn as a physician with you guys out there. So the more people that see this content, the better for everyone. Let's start with physical therapy, which is the cornerstone for managing knee pain. Physical therapy focuses on exercises that strengthen the muscles around the knee, improve range of motion, and reduce joint stress. It's especially great for those with early to moderate osteoarthritis or anyone dealing with knee pain from overuse. Now, physical therapy is basically a set of guided exercises aimed at strengthening muscles around the knee joint. Research shows that physical therapy can significantly reduce pain and improve function over time. In fact, a study published in the Journal of Orthopedic and Sports Physical Therapy found that patients who completed 6 to 8 weeks of targeted exercise therapy reported up to a 50% improvement in pain levels. Our recommendation at Dynamo Health is that physical therapy is a must-try for every patient looking to treat knee pain without medication or surgery. Next, let's talk about topical medications. What we're talking about here are things like Voltaren gel or diclofenac. These are creams or gels that you can apply directly to the knee. These work by delivering pain relief right where you need it, on the surface of your skin. They're a good option if you're dealing with mild to moderate knee pain and want to avoid the side effects of oral painkillers. Now, these topical creams and gels often contain what we call NSAIDs, non-steroidal anti-inflammatory drugs. These are over-the-counter medications that treat inflammation. By applying them directly to the skin, you're essentially getting a localized reduction in inflammation and localized pain relief. Common options include diclofenac gel, which is called Voltaren, and things like lidocaine gel as well can be used. What the research shows is that topical NSAIDs can provide pain relief similar to oral NSAIDs without the risk of gastrointestinal side effects, and this makes them a safer choice for long-term use. A personal anecdote on this: I don't know how many times I've seen someone in my clinic who has been taking things like ibuprofen or Motrin chronically for pain. And I tell them, listen, I know you're in pain, but you've got to stop with the ibuprofen. Taking that medication chronically over time is basically asking for bleeding in your GI tract. And that is a horrible outcome for someone who's trying to deal with pain. You're just basically creating a new issue. Our recommendation at Dynamo Health is that topicals are great for those with mild pain or people who want to limit oral medication use. Just remember, these are best used in combination with other therapies to get a really great effect. Next, we'll move on to the oral medications. We're talking about things like ibuprofen, acetaminophen, diclofenac, naproxen, Mobic or meloxicam, which is actually really favored by a lot of surgeons for joint pain. Oral pain relievers work systemically to reduce pain and inflammation. They can be effective for reducing pain, but they do come with some caveats like we just mentioned. According to a meta-analysis published in Lancet, NSAIDs can be highly effective for short-term pain relief. However, they carry risks like stomach ulcers and kidney issues, especially with long-term use. Our recommendation at Dynamo Health is that oral pain medications can be useful, especially for acute flare-ups of pain, but they should be used with caution and really under the guidance of your doctor. Chronic use of these medications, like I said before, can really result in disaster. Next, let's talk about knee injections. Now at Dynamo Health, I consider this to be one of our specialties. If you're someone who's dealing with more moderate to severe knee pain or symptoms that have been going on for quite some time, then a knee injection is something that you might want to think about. Now, there are a lot of medications in this category, and we can break them down into just a few key categories that I think will be useful to talk about in this video. The first major category I want to talk about are corticosteroid injections. So first of all, this is the most common type of injection that I administer in clinic. The corticosteroid that's typically used is called Kenalog or triamcinolone. Corticosteroids work by reducing inflammation. They directly modulate the immune system's response. And the idea is that you have an inflammatory cascade that's been created by chronic inflammation within a knee joint, specifically because cartilage has been damaged or lost over time, which is what happens in arthritis. And that bone-on-bone sort of scraping or osteophytes, which are little tiny bone fragments, are creating a lot of inflammation within the joint. By injecting a corticosteroid and reducing the inflammation, the idea is that you're going to kind of put a tamp down on that process, thereby getting pain relief. Now, typically with corticosteroid injections, you're not just getting the corticosteroid, but you're also going to get some type of anesthetic. It could be lidocaine or bupivacaine that will be injected in a mix. Here at Dynamo Health, we have a variety of personally tailored knee injection mixes that we use. When I see you as a patient, I talk directly to you, get some idea of where your pain is, what you've tried in the past, and based on that interaction, I decide exactly what specific mix is going to be the best for you. Now, one thing to understand about cortisone shots is that they might reduce pain in the short and sometimes even the medium term. But over time, especially with repeated use of knee injections with corticosteroids, you're going to get shorter and shorter duration of action and higher likelihood of side effects. The biggest side effect to talk about with corticosteroids are the fact that over time, they can result in breakdown of the actual cartilage in the knee. This is something that's crucial to understand because what it means is if you continually get knee injections over and over time, what could end up happening is that more damage can be done to the knee joint, which obviously will result in worse pain, and that's not what we want to achieve. Typically for patients I see, I do have kind of a hard cutoff. If a patient has received up to 4 knee injections in the past, I say, hey, listen, maybe we should look at an alternative rather than continuing down the same path with a corticosteroid injection, which is at that point likely causing more damage than good. Other alternatives to talk about include hyaluronic acid injections. There are a few different sort of brand names in this category, things like Symvisc, for example, and other hyaluronic acid mixes. These basically work by supplementing what's a naturally occurring substance within the knee. Your knee joint essentially has hyaluronic acid as a lubricant within the knee joint, which normally allows all the structures to glide against each other. Over time, due to the inflammatory cascade caused by osteoarthritis, that sort of smooth gliding motion can be lost. And the idea of reintroducing hyaluronic acid is basically to reintroduce that substance that can allow that smooth gliding motion. Studies show that there is not only an effect of directly introducing hyaluronic acid, but actually stimulating endogenous production of hyaluronic acid in the joint after these injections are given. One important thing to note with hyaluronic acid injections is that it's always recommended to actually aspirate any of the inflammatory fluid that's in the knee first before the hyaluronic acid is introduced. Like I always say, this is something that you want to discuss directly with your doctor, and it's going to require a personal evaluation of your specific situation to determine whether a hyaluronic acid injection is going to be right for you. There are other injections in this category, including PRP and prolotherapy. And these therapies can also be considered depending on the type of patient. PRP, which is platelet-rich plasma, uses your body's own healing power. Research published in the American Journal of Sports Medicine found that PRP can offer longer-lasting pain relief compared to hyaluronic acid for certain patients, though. Study in arthritis care and research suggests that hyaluronic acid can provide moderate pain relief for up to 6 months, while PRP may offer longer-term benefits. for those particular patient populations. At Dynamo Health, our recommendation is that knee injections can be a game changer. This is what I consider to be that zone between mild pain that you can deal with kind of over-the-counter medications and super severe chronic end-stage arthritis type pain, which is where you're considering surgery. Everything in between is really where we at Dynamo Health are trying to bring the maximum benefit to you as a patient. We're trying to allow you to have the greatest amount of preservation of knee function and reduction in overall symptoms, whether that be pain or limited range of motion, in order for you to stay active. That's really our big focus. Now, if you've tried everything and you're still in pain, then knee surgery might be on the table. But when I say I've tried everything, oftentimes the conversation I'm having with patients is about how they've gone about implementing things like physical therapy and how much of it that they've done in their life. Also about how consistent they've been with exercise regimens. I would say that 9 times out of 10, I find that patients can benefit from incorporating more of the things that we've talked about in this video before considering something like a total knee replacement. I'm not a surgeon, so I'll leave a discussion about different knee surgery modalities to those folks. In general, I always try to help patients by going through the full range of non-surgical options before saying, hey, maybe surgery is something to consider. One thing that's important to consider when talking about surgery is that surgical procedures aimed at repairing or replacing damaged parts of the knee joint can have varied outcomes. A study in JAMA highlighted that while total knee replacement can improve quality of life for severe cases, outcomes are highly dependent on factors like age, weight, and overall health. So, bottom line, at Dynamo Health, our recommendation is that surgery is the last resort. It can be game-changing, life-changing even for the right patient, but make sure that you've tried all the other options first. So, those are the best ways to manage knee pain. From physical therapy all the way to surgery as a last resort. Remember, there's no one-size-fits-all solution, but with the right approach, you can get the pain relief that you're looking for. Here's a summary table of all the ways that I treat knee pain and what I think about each particular way. Credit to Dr. Jeffrey Peng, whose YouTube video I first found as a resident a few years ago and built on as I went through practice. I'll link to his original video in the description below. If you found this video helpful, don't forget to like, comment, and subscribe. It really helps this channel grow, and I appreciate every single one of you guys. And as always, stay dynamic. Peace.